今フィリピン・マニラにありますエルミタ地区というところに来ています。現在外の気温は37度くらい、体感でも43度くらいと非常に蒸し暑いです。なぜですね今フィリピン・マニラに来ているかと言いますと、グローバルヘルスの観点でフィリピンでのワクチン接種の格差、そして不平等さが広がっているのではないかということで現地に取材に来ました。特に新型コロナウイルスのパンデミックの時、フィリピンでは経済格差からですねワクチン接種を受けられる人と受けられない人、その格差というのが広がったというふうにも言われています。2024年現在、実際その状況はどうなっているのか、そうしたことをですね現地で取材をしたいと思います。
Regular breathing. You might forget to breathe, huh? Okay, just press on this first. Press on this.
私は今フィリピン大学に来ています。この後ろ人が結構にぎわっているんですが、何かと言いますと今ここではですねワクチンの無料接種イベントというものが開かれています。フィリピン大学のですね医学部に所属している学生たちがですね、運営スタッフとなっていて、インフルエンザとそして破傷風のワクチンどちらかを無料で受けることができるよというようなイベントだそうです。15年続いているそうで、ワクチン接種の啓発そして教育のためのイベントだということです。来ている方たちは、普通にマニラの市民の方だったり、あとは大学やそしてすぐ近くにあるその病院に勤めている方たち、そういったスタッフの方などがいつも来ていて、結構すごい人数でにぎわっている様子が伺えます。
They're here in the campus, and also we have also been reaching out to other communities, not only within Metro Manila but also elsewhere. The National Immunization Program here in the Philippines, which is our version of the essential program of immunization. Our aim is to cover 95% of our children.
95% is very easy to support.
Difficult, but yeah, if our heart is into it, we will pursue this, and we will really work on this. Yes. Patients who refuse to have themselves vaccinated, and of course we would respect that. You know, we cannot force a patient to undergo a procedure that they would like to undergo. So, but then again, we try to educate them some more, try to open their eyes to the benefits of vaccines. Yes, I think it's education.
Which kind of vaccine did you get here?
Oh, now I got a flu vaccine. I was actually hoping also for a pneumonia vaccine, the Pneumovax. It's supposed for people like me, senior citizens already. We need pneumovaccine so that we don't become prone to develop pneumonia in the community. Unfortunate that the vaccination status in the Philippines is not ideal among our Filipino people, especially those in the rural areas. We have to eradicate all other viral infections that can be actually eradicated by means of proper and adequate vaccination.
So why do you come here?
It's free because the vaccine outside is so pricey. Yeah.
Which vaccine did you got?
Tetanus. I think this event is very nice because some people or some employees or students can't afford the flu vaccine or the tetanus. Yes. Because of that.
In Philippines, the vaccine percentage is not so high.
Maybe because the distrust of some people to the vaccine.
So,
Because of the distrust.
so some people are afraid of the
Yes,
vaccine.
afraid and don't trust the vaccine.
For me, it is a very sustainable project. So even if you're not from PGH, the Philippine General Hospital, and even if you're not from UP Manila, we can accommodate you. It's very energetic and very fun to be here because this is not just an event or a project wherein we provide vaccines, but this is also an avenue for medical students to learn how to administer vaccines, to learn how to talk to people, to learn how to explain to the masses about vaccines. So it is really not about, it is not just about service, but also about scholarship.
Now and always we'll remember all the good things that we have done. The rose and the fervor of the music Mavi sorority.
Yes, kuya.
They said that they were able to acquire vaccine brands from different countries, like the Sinovac from China, the AstraZeneca and Pfizer from the Western countries, and despite this huge influx, the huge influx of vaccines, despite them getting emergency use authorization, with a far shorter time of acquiring permits than it normally would require, lots of VIPs still managed to jump in line. There were lots of mayors who got the shots first before rolling it out to their own cities and municipalities. When the poor had to acquire for vaccines, they were lining up for so long and under the heat, and they had to present their government papers. Whereas I heard in some areas, in the more economically advantaged areas, the rich would just have to wait in line under an aircon in a closed room, and it was a very relaxing trip for them, despite the harrowing scenes that some of the country's poorest had to endure. The company issued a warning that, oops, this may be fatal to children who have not received a prior exposure to dengue. So as a result, there was a huge outcry, and because of the clamor, there were some reports that several children have died, probably because of the vaccine. And because there was so much distrust and there was a huge scandal, actually, there's still no official consensus on if the dengue vaccine really really killed those kids. But despite that, the fears that they inflamed were very real. So even if we're still not sure now, what's really sure is the fear that they caused to millions of Filipinos, and that fear was still even more felt now, even more felt during the COVID pandemic more than ever.